Third, we have to improve our early warning response system so that when friends, family, and neighbors. So we have to confront the issue, and we have to discuss mental health, and we have to do something about it. You know, in the old days, we had mental institutions. You had a lot of them. And you could nab somebody like this because, you know, they did. They knew something was off. You had to know that. People were calling all over the place. But you used to be able to bring him into a mental institution, and hopefully he gets help or whatever, but he's off the streets.
Well, I went to medical school and then trained in psychiatry, and I've spent most of my career doing research on the neurobiology and psychopharmacology. The president, by saying maybe we need more mental hospital beds and expanded inpatient capacity, has a point. There are too few beds, but the whole trajectory of mental health care in this country has been for the last 50 years to reduce that capacity in the guise or in the interest of providing more humane care. The problem is that it was easy to say we're going to close hospitals, we're going to reduce the budgets of states for mental health services, but they didn't provide anything in order to care for people in the community that's required. And as a result of that, we have the homelessness, the prisoners with mental illness, the mass violent events, the addictions, and a variety of social pathologies. So you can't have it both ways. You've got to, if you're going to reduce hospital beds, deinstitutionalize, which is great, you've got to have adequate services, and we haven't done that.
I talked to her advisor at Hopkins, was the interview I had.
So I think, I don't know what the reasons are, but Briggs, I think we can retain on that. In fact, close to 50% of mass violent attacks are by untreated people who have mental illness. The other largest portion are terrorists. So the way to stop mass violence is to stop it early in the course of people developing mental illness before it gets so bad that their symptoms can impel them to do these terrible things. And in almost all the cases that have occurred in the last decade or so, including the most recent with Nikolas Cruz, there were warning signs long before it ever got to the point that they were going to commit some kind of atrocity. But people sat by and either didn't do enough or felt they couldn't impose constraints on somebody's individual freedoms. There are multiple contributors to the problem, but they're not necessarily the same or even completely related. So, gun control. Should we have gun control? Well, that's a personal opinion. I personally believe we should. Why do we need assault weapons being available? But even if we had gun control and there wasn't access to firearms, if we didn't treat people with mental illness, we would still have violence. We would just have violence with knives or with hammers or with something else that could be used as an implement of destruction. Now, true, many fewer people would be harmed by it, but some people would still be harmed by it, and it's for the same cause. Disorders meaning schizophrenia, schizoaffective disorder, bipolar disorder, depression.